Facelifts are really great for patients whose faces droop a little bit. So as we age, gravity is a very powerful force, and it pulls some of the structures of the face down. And people get little jowls that form next to the mandible. They get these little lines at the corners of their mouth. The cheeks begin to sag. Their necks begin to sag. They get these vertical lines in the neck. All these things are the effect of aging. For my poor female patients, as they age, their faces look a little bit more masculine. Female faces should have nice, in general, I'm speaking just in generalities here, generally have nice large cheeks and a much more heart-shaped face that comes to a tapered chin. Male faces are more square, and the aging process makes my female patients' faces look a little bit more square as they get the jowls and the neck that droops a little bit. So a facelift really helps them look more feminine, more like themselves, helps them find their look that they've lost as a result of aging. So a facelift, of course, is not the entire face being lifted. The term is a little bit confusing. It really is a cheek, jowl, corner of the mouth, and neck lift. And all those things get pulled and tightened up. And you can get a sense of what it might look like by just looking in the mirror and gently pulling back above your ears and behind your ears and seeing what that does to your facial structure. And then the question is, what do you want to achieve? Do you want to help the cheeks lift up? If so, then I recommend a deep plane facelift. Get rid of the jowls, get the cheeks restored, get rid of the extra skin in front of the ears. And it can also help the neck somewhat. But if your issue really is neck being full, then we have to thin out some of the fat with liposuction. And then there's muscles in the neck that you can tense and tighten. Those muscles in the neck get pulled back. That's a neck lift. So you can do the face lift and a neck lift at the same time. So it improves both the face and the neck. You can do them separately, but separately, they're a little bit less powerful. Do them together, you get both effects for the face and the neck being tightened up and supported and lifted up vertically at the same time. And you can also do a midline incision under the chin. If you do a nice incision, nobody needs to see it. It's tucked up under the chin. It allows you to get down to the muscles in the front here and tighten those and pull them tight together. And that really helps create a nice, beautiful, what's called the cervical mental angle, that kind of nice chin line, neckline that looks sculpted and youthful and sharp and clean and healthy. The deep plane facelift requires expertise, requires a detailed knowledge of the facial anatomy. So that way you can do the operation with confidence. And there is a little bit higher risk of a potential nerve injury doing this because of the depth of your dissection. I've never had a nerve injury doing a facelift because you need to know where those nerves are. It's still a very safe operation, but done in an experienced surgeon's hands. That's the difference. A well-done facelift stand the test of time, last for a decade or two, look natural, avoid ugly scars, and just look lovely. My experience as a facial nerve surgeon is critical to my being able to offer a really nice, lovely, and comprehensively performed facelift. I work on those nerves every week. I know exactly where those nerves are, so I know how to avoid them. It gives me tremendous confidence during the operation, and myself and my colleague, Dr. Park, are both doing these on a routine basis. Being comfortable around these structures, knowing what you're going to find, and having been there hundreds of times in operations allows you to be able to do this in a way that's safe for the patients and avoids the complications and problems. 2 to 4 weeks after the surgery, people will have some redness of the incisions, maybe a little bit of puckering of the skin up high from the tension put into it, a little bit of swelling, some bruising in the neck, and the décolleté will have a bit of bruising. But except for that, modern surgery should give you incisions that go inside the ear and carefully are artfully performed around the ears so that nobody needs to see the incisions. And then preserve the little tuft of hair in front of the ear in its natural position, so that way it doesn't have this hair pulled up or wrinkles by the eye. The hairline in the back should be invisible. No one should notice you've had an incision there. So if patients want to wear their hair up, no one can see the scar. There shouldn't be any visible scar along the back of the neck. And then the hairline should just be smooth and even. There shouldn't be any big step-offs or irregularities. So that way, all of the signs that shout out, I've had a facelift, you can avoid. So that way it just looks natural. You really want to be careful to whom you trust your face. You really want to be careful in selecting a surgeon who has lots of experience and has expertise and great education and all these things that will help you make the right decision. Do your homework, and I would recommend that people get multiple consultations and ask for results. Look for photos and some results of other patients. So that way you can see their work and make sure that you like this person, and because they're going to be your partner as you go through this journey together and help you overcome any of the small issues that arise with an operation. So many of my facelift patients don't want to have their photos be public. And so I respect their wish for some privacy and confidentiality. Many clinics, they force their patients to sign off their photos. We don't do that at the university. Patients had to volunteer that. And so I have a large collection of my results in a photo book that's available to be reviewed in my office. But I don't advertise my patients' faces because they prefer not to have that be available online. But if you come for a consultation, again, our website is facialplastics.ucsf.edu. We have descriptions of our services and our team. You can meet all of our team members. It tells you how to schedule a consultation. And then when you come in, we're happy to share with you all of our results. And again, we have the ability to, which is really fun, to take photos, both 2D and 3D pictures, and then we can actually do a simulation. We can show you what your face might look like afterwards.